Hospital. Actually, it will be the first psychiatric hospital in this region. Those are specialized areas that we are targeting. Specialized areas. Ngekerota kita mangana ekurigiri go bongo uriro bongo. Nyegota mangana ekurigiri, like another example is Keroka. There's a new facility which in the next 1 month is coming up. A level 4 facility. Ekorosigo Pakamochori. So in the next 1 or 2 months, one phase in the next 1 month it will be completed. The second phase in another period of 2 months will be completed. Meaning these facilities are upcoming. Something itarengo in 2013, which because I've told you about Gesima. Now I guess Esani, that facility is completed. There are few technical issues which we were discussing with a number of people, whatever the stakeholders. We went to Korwa and they will shift to the new facility. We now turn it into a totally different thing. We can talk about Korwa Manga. Of course, there's an inpatient facility. There are Manga. There are some technicalities which are being sorted, and I know in the next 1 year, Manga will be completed and we'll have a different look in Manga. And of course, all these things, it comes with equipment. You want to go fitted. You want to go to a new staff who are supposed to be employed. It comes with a totally budgetary, expenditures you wanted to come and put in place, and of course several other places. Let me give you an example of another place and I was so impressed. Nyangena iye kutoka rogora Manga, Kemera, Igoradi, Nyangena Neroro. People have been crying. Community are very wakajisiming, Daktari. Akikupunoga to Tara Viego, Tara Nyangena Renki. So I told my team today, Totago Nyangena, Torenki K100, and we got to Nyangena. I was shocked. There is a totally serious facelift of Nyangena, and we are opening Nyangena, a new facility altogether in the next 2 weeks. So what does that come with? Allocations. Now, let me also tell you about Nyamira Hospital. There is, of course, a doctor's plaza which has staggered for long. Nyamira for some time. But in the last 2 weeks, there are some payments which go which as a contractor. And the payments have been done. And in the next 1 or 2 weeks, we will have a different facelift. Of that facility, because now you're talking about we're in the ground. You can talk about level via so that one carry me to a corridor is going to go na leveling of the ground. Nyamusi, their facility in Nyamusi is going on. I'm just giving you those I've visited, and of course when I got into office, now to chief job you see 2 days ago. I've been looking through the facilities and I wanted to confirm facility. Those are the facilities I've walked into. Ekerenyo, there's a facility, the national government supported us. Already it has started coming up, right? There are a few technicalities and Ekerenyo. So in short, what I'm telling you, infrastructure-wise, if you want to rate Nyamira, don't rate Nyamira na Bosongo. Don't rate Nyamira na Homa Bay. Don't rate Nyamira na Nairobi. Rate Nyamira with Nyamira. How? Where was Nyamira 5 years ago? Where is Nyamira today? So if you see a trend of growth in Nyamira today in terms of the facilities that we have, don't do it. We are growing. Rome was not built in 1 day.
Okay.
Yes.
Pengana ya Mariogo.
Yes.
Kulmaiga tuwabeire tokorora na numugava no kola launching ya Mariogo.
Yes.
Egari kanta yareta Mariogo ne box ya umura. Matukabe Mariogo taye nyagitari Nyamira. Matukabere Mariogo tari gotoka. Nemegano yabireke gukora ugo yobo ibibwa bwa Mariogo. Metentwa yikwane tenga kiendeiga. Lakini rende nkyo muchando abire gokoba Mariogo yagusirengira yobo botutuka nukiyo borororo kwabire gukorigerere nande kwararenga no bwatari ikibugo kimutugaye.
Yes. Zach, kana be kuntene muri Nyamira Hospital. One of the things here kwanetwe ngeringa Mariogo.
Yes.
nyagitari mugwate mabo bakwiba Mario. I don't want to defend them. I didn't want nata kitemba defending Mario hivi. So I set out traps. I set out ways. Chukuri ringa ki kene Mario gaya wanonko ibwale. Now ntaitenko my finding.
Okay.
Allocations chigo cha health na gote binga kichira. The largest percentage each allocation age you go kogende into your salaries. These are the little parts of tigara. You go kogende into your development, including drugs, including contracted services. So Kwanyora, for a long time, Nyamira, we've been getting allocations to Mario. Nyamira County, I'm talking of Nyamira County. We've been getting allocations to Mario around 100 million. To go to Mario for all year. 100 million, Kwamanya created the facilities. I didn't tell you. In 2013, we had 68 facilities. Today, we have 103 facilities. So it means every facility neta get Mario. So kwama you divide yourself across. You know drawing rights. Kwama like for instance, Nyamira Hospital in a quarter, we should have a drawing right in a quarter to a tune of 20 million, 20-25 million. But Nyamira Hospital gets drawing rights of around 10 million. This 10 million, na ended yenye break further. 10 million, ekera Marioga ya mua tumira retwe. Aretu Marioga, kwa Marioga 10 million. At the end of the day, Marioga kore tugaiga, igara Marioga almost 3 million. Na Marioga ya went to kogenda for a whole quarter. Taringa nkende, it's because initially we had a problem with cancer. And we had a problem in cancer, kwa nyoranga tarigocha, order kwa nyama Marioga tenaro, but all other counties are ordering. By the time ucha wikerwa kwanyora Marioga tukonya wardira correct tayo. So kwanyoranga amarioga gocha tari alionzo wardete, it's just a few or a little of the drugs that you've ordered. Okay. Because of the volume ya barwire barororo. Barwire ba tekerwe gurenga amarioga chire. Amadora so nyagitari. Abone nyagitari ta Marioga na roro. Amarioga went to kwenda within 3 months, for a period of 3 months. Kwanyanga Marioga ya within a period of 1 month. Or 1.5 months, Mario ya correct. I had it because of the volume. Nail allocations, three allocations. The amount of drugs chire limited. So kwa manya kwa this one, manya kitari Mario okay wacha koyo. Of course, they didn't defending tari koyo. So I told my people, the people had set out. Di to kokonyo di go to okay. Bring it to me. Take action. I have not to tell that you to get a cabin. What tinta negative and taking a Mario take. Of course, I can know Monto what I want to be black sheep in Yanakova. There's that bad element. When you're a bad element, you're not going to kick narrow the larger aspect.
Okay, utana gende gento yakabere waziri. Could it be Amarioga Yanigo, Kerokenda, Kobiswa, Egere Agoru Korugeita is go yakura. Chinkumanchiro oro nande cyabere kigo chikwaine kiwa abanyigitari abange naho babegete chi clinic bose bi chemist sikogaria say that wache imebega ko ari kerwe ryogo ryaboranya gitari wato musi ko chikorigorase chibese kinyinge abuwange nande wachi kunga gende ke chemist gete.
You see tari yako biswa akiagera of course into water systems. I have to agree there are some weaknesses. Paper systems. There are weaknesses with the paper systems. The paperless systems, they are not updated to a point okonyara wikera some levels. Mariko taringa gako biswa. We do audits, we do checks, the drugs are there. But what happens, whenever we have drugs, there will be supply, people will get drugs. Lakini within that period of time, when you're correct, I had it. Can I edit it? Then you will be sent to buy that drug. However, I also agree. One of the chemists, was it 2 or 3 of the chemists, kwa balikira nga ogende chemist get. This can happen. Tindi gukana nga kiri happen. But it's not happening asenge njo mariogo igaro abisire. Munyagitari uyo kulika mariogo. Taliko kora famous. Erege ndago korunga no koewe list ayanara mariogo aro lero. Usara na nara mariogo aro wiki. Ukulika mariogo lika komatenga neri ndiro. Ayande takoya tiki tayo. So and of course sometimes again to kende our people need to know what the government provides are essential medication. We have the drug formulary. Koba updated regularly. Korokinga marioki awene tokotoka at a certain time in a public setup. So kwa nyoranga if you kondiru munyagitari agocha, some of the doctors are very good. Iga kolikiranga ki daktari. Ay umurweire ne bagwacha igatiango tebia ken. Iriogeriro rinto ribwate nyagitari iga. Lakini rindo gwene buna na kurigereiri. Please gachugure riogeri. Some people also take it the wrong way. So nakina ngo tabanga tari ngo konyoranga abantu ba amagiriogo gakubiswa. Ndo munyagitari uri uri keriogo geterire chemist gete. No, it's because okonyoranga the volume of or the number of people to buate asinya bagoche nyagitari ko wene vis-a-vis nam the consignment yogocha kwanyoranga terikoenda long kwanyorere. Now let me come to the point I wanted to say, which is the most juicy part nanchire. When the governor came in, the allocation of drugs has to go up. And I'm telling you, the drugs we used to get to a tune of 150, 100, I think it was even less than 100 million.
Yes.
It has come to 150. He has promised that it can go up. We are doing a supplementary budget. And one of the areas to get the area ya Mariogo. So that it's supplementary, to be as a Mariogo, some amount of money is saying, and we do this. Again, to Kende at Tebire, and that is what I've started to do with my team. Can we have a legislation? A legislation in the Karichiko, the county assembly. To ring fence, no ringa, Amarioga Yabano Tunya Gitere. Yes. Chibasa Chamariogo to cake to Chigitere. So that we have a revolving drug fund, which needs a lot of support. Chibasa to Chibeke, Tomanga, we have 100 million. There are 2, 4, 5 companies. These companies have been told to tailor make Amariogo specific on Nyamira. Then Amarioga Nebang and Tora Bakana, because we have already ring-fenced the money, they can supply. Now to Amarioga to Abakana in a way which we've agreed and a memorandum of understanding. It is already something which we've started working on. It has been worked on. We are looking at the nitty-gritties here and there. Assembly to Eteria. Which I know Nyamira will take on the past. I think we'll be the first county to do the ring fencing. Mariogo, not doing that revolving drug fund legislation. Iranto konye to ring fencing. Tuanyora Marioga tailor-made for Nyamira. No gende company area. Diogo dina bokonyo diba bokonyo lidi kire GOK. Konyo lidi kire county government of Nyamira. That is one area we are also trying to look at. Then finally, as Magana ya Mariogo, we are also doing a system. We are now setting up. That's one thing, Governor. By the way, this evening, before I came, there's a meeting between Extra Solution, the implementing partner of Microsoft in Kenya, Huawei in Kenya. The Extra Solution, there's a meeting. The meeting is ongoing. What is the essence of Mukutano? The best systems. In managing healthcare. Healthcare is big, a wide thing. Yes. But we are looking at human resource. We are looking at Amariogo. We are looking at reports that are coming from this. So that at a click of a button, I can know nyagitari kurukuche ngombe. Mariogo gete nawe nteko bororo na igetororo. From that I have known never really bari ngabaro liru ororo na enda Mariogo na tomutu chuo panda do chit na Mariogo bari baro 20, then it means panda chiwento kutika roire 30. So that can also do checks and balances.
Okay.
Yes.
Asante sana waziri akira tugendrete gusanga netokugenda omotimoko tunyora amang'ana mayasi nche goikera no yekinse isato chiabona maragoba alafu ntoirane egera bona tunyara kuba tugokora asensemo ya kabere y'umurobiro yiga tunyara kuba tugosanga
aya namang'ana maya asenjera y'uwekiranu kurwa chinkonko inyichense ime ya Radio Vuna. Aya namang'ana maya asenjera y'uwekiranu kurwa chinkonko inyichense ime ya Radio Vuna. Aya namang'ana maya asenjera y'uwekiranu kurwa chinkonko inyichense ime ya Radio Vuna. Aya namang'ana maya asenjera y'uwekiranu kurwa chinkonko inyichense ime ya Radio Vuna. Aya namang'ana maya asenjera y'uwekiranu.
Serikali yase ogokwana n'umurai omunene bwense Moske William Ruto okwana yemase mumurai bwense William Ruto nigo asioriri bene ali barakwaneire eri gotinya obwamate bwekize kibere n'abafoza nigatebire buna bono Kenya nigo era kigwanchira gutandira ya South Africa efiseta yo.
Kenya's appreciation on the progress we have made in the long-awaited visa-free regime between Kenya and South Africa. From January 1, Your Excellency, we will have a different regime thanks to your personal intervention on this matter and the wealth of experience that have been brought on board by your officials.
Mwigoniga barajabu bayekiriro kwigwana kwa gochego kindi obonchulya gati ekinse kibere.
Kenyans holding ordinary passports will be allowed to enter South Africa on a visa-free regime for up to 90 days per calendar year. The two countries have also agreed on a return policy when immigration laws and regulations are breached to make sure that bad elements that try to infiltrate our borders are dealt with firmly and decisively. President Ramaphosa and I have also agreed to develop a sustainable mechanism to identify, monitor, and resolve non-tariff barriers that limit the trade potential between our two countries. We can only reap the full benefits of the MOUs and agreements we have signed through the full and effective implementation of all the undertakings we have committed ourselves to.
Okwandekera ekibwegoro toligalirire yogocheko bwaterana n'ekize kinde eryokoyanekyo ogoting'igwa kw'omulembe ime ya rugonko rwa Africa.
We are concerned over the continuing threats to international peace and security, particularly conflicts in the Horn of Africa, the Great Lakes region, and the Sahel. These conflicts cause suffering, disorder, and lead to unsafe migration and weakening of states. Your Excellency, I want to thank you specifically for providing the necessary leadership that saw the resolution, at least at the technical level, and now that implementation will be carried out on the matters between Tigray and the government of Ethiopia.
Omuchando bwelire boigo ndigora chikumulekirwa sobo imene gati ya baraikuru serwango rwa Afrika nera sensemo ya nyera mafosa ndigalirire yo goche kubwaterana nense ya Kenya heli kwegendereria sencherengia.
This visit has once again reaffirmed that our bilateral relations are based on a sound foundation of mutual respect, shared values, and friendship, and are also based on our democratic values. These principles will undoubtedly continue to serve us well into the future, especially in times of global uncertainty.
Levis Obuyu.
Omuwaziri w'abakora imirimo ba serikali munagenda aiga Shajuma oganije musori munane bwa serikali gutugutara lekine kikimugwatiranete anigo sori gosenga ayanigo asiuliwa muno wakiri oye Darson Omar oyote biro muno bosaiti obwo abwata sekine kyombo bwati nguru.
The court will open up that matter and allow the new material to be brought, because the essence of a criminal justice system is justice. We have produced that to the Director of Public Prosecution. Remember, the Director of Public Prosecution does not take instructions from anybody. But on terms of withdrawal, he must get permission of the court. We are very certain in the Mombasa matter, the court is making its ruling. On the anti-corruption matter for Aisha Juma, we are expecting the director to move to court in the murder trial so that it is terminated, because evidence does not link one Aisha Juma to that matter.
Abamenyi b'ekisab location kyakerera na kirikiriki kutoka sebodi y'ebintu ya county ya Kisii bese okelera sobunge kurwa birero biregereri byabo kubwatekera n'amagenderero ali aho baganete kucyokorero ne serikali ya county ne lienene mu MCA bwesemeyo nakera na serikali y'ekyo muno muri kito Franco Koya gutumanya.
Aya namangana maya asenjera yuwekiranu kurwa chinkonko inyichensi imeya Radio Vuna. Aya namangana maya asenjera yuwekiranu kurwa chinkonko inyichensi imeya Radio Vuna. Aya namangana maya asenjera yuwekiranu kurwa chinkonko inyichensi imeya Radio Vuna. aya namang'ana ya asenjera yowekiranu kurwa chinkonko inyechense ime ya Radio Vuna. Aya namang'ana ya asenjera yowekiranu kurwa chinkonko inyechense ime ya Radio Vuna. Aya namang'ana ya asenjera yowekiranu kurwa chinkonko inyechense ime ya Radio Vuna.
Mbuya muno mulikito Franco Koya sorobotirwa uruikirano. Serikali ya kaunti ya Kisii yatuguteira ale license cy'ebirabo bitano ensemeyo hasobono abanyene ebirabo ebyo bamirunganirikirage mulikito Emily Kwambuka nabwatekerero kyabo. Lakini kwa tabato aine reji ni naga tulibet.
Mina launch 7 says Sweet Mississippi amune binde ime county ya Kisii. Yote nene tekyo hata vile buna iba ya biro mchana sibia sara vya wako sieko asogo tai we notice ndonsi aswana sabira serikali kwenda ni notice asikitambo kiro kindi yonsi eyo kutange michande yonsi wakorekana.
This unfortunate kwamba wenzetu wamepata shida, wamefungiwa makla na basi bila hata kupeana notice. Hii ni hasara kubwa sana imetokea. Sisi wenyewe ni viongozi, tungefaa tuambiwe sisi wenyewe ndio watu wetu peane mawaida na tuwasomeza mambo ya kazi vile ilivyo, lakini kuna mahali sisi pia tunaona tunateseka sana. Sasa ninaomba serikali, wakati nataka kufanya kazi yoyote ambaye inatakikana kuhusu mambo ya sheria, tujulizwe. Hasara imekuja ni kubwa sana. Tuko na watu tumeandika, kazi wote wameenda.
Chimba kia chupa higo, hoyo tenene club kia Sweet Mississippi ya serie tadio. Ate bile buna hege korekyo, nege ugosaririe dieta ibira ubinde bila se umuchuko songo. Nabo higo banta bangi nigo bagwetera makomu, mageye biasara byabo kubwase kerengo keguru.
Kwa majina naitwa Duke. For me, I'm representing Mississippi. We were not even given the notice to close Mississippi. Mississippi closed 1 month ago. So this I'm hearing yesterday that Mississippi was we never got even alert to close the club. So we were renovating the club to open later. But hii ni paripia vile club mingi hapa Kisii majina na watu wengi wameathirika vibaya sana.
Nabo higo sense muyende nigo batebire buna mari no kugani okonge biroro byabo koigwekana. Eyo gokonywa ase biasara byabo asibatebire buna nigo baetira makuru kubachenga kichira cha corona. Nabona nigo bonchoreria bwabo gotera ingokapia.
Hatukufurahishwa kama viongozi wenye wanasimamia au wenzetu kwa sababu tunataka kusaidiwa kwa njia yoyote ili biashara zetu zisonge mbele. Mkumbuke kutoka nyuma siku za corona, biashara pia zinasimama vizuri. Imefika wakati sasa county manager anasimamisha hizo vilabu sifunge. Hatukufurahishwa kabisa kwa sababu hapo ndio eneo la biashara.
Niko nipatire tasini kere dovuna. Ninchi Emily Kwambuka.
Mbuya muno mulikito Emily Kwambuka sorobotirwa uruikirano. Abamenyi b'ekinyaro gya Kigwanda ikigotoka se bodi yali goma miye kitutuma sabase county ya Nyamira biroro bale kubatekana no kubara Westman semeyo banta buri gobatebire bune estima bali reto ira koye wana mubunga obo mokorosha drag John Mose nigo yakwamire no nyamaga yabo kugwererirwe ebicanga gucya sinyomba cyabo nakobekere transformer yasabone taroki wemeti yeremenge banta buri gobakwanira no burro bonge asabono baganiri oyo begete transformer yesemeyo achagiyo yesenge jote bwatimiremo bamenyi abo bakegwanda nigo bono babodire mubunga obono asensemeyo Cliff mbanegi sairo kwendeke buna obatongeiri estimeyo asoroboti uruna bamenyi b'ekenyero giake gwandiki gotoka se wodi yeri goma meki tutuma saba se kaunti ya Nyamira mbire robale kubwatekera no kubara Westman semeyo na ngwekera omwalio pomangana maya senchera yobwekerano kumenebere chamabya onyora yanda senchera yobwenge nchengoro kwa Levis Obwoge.
Asante sana ndomo tegereria ndonsi asore ndonsi asogendrete korigereria gwetera YouTube at Vuna TV chida kechi abutokira 22 gore chinse isato chiabona maragobe kira gwakorera konyora mangana maya senjire we kirano bonongo kwarigania naboigo gokumanyingo murobiri gwetochi goturaye nyore kera twakorire chinkwane chige maragobe yabono tonyora murobiri gwetochi chinsenye chiabono maragoba Endago tubwate gwetera se fan page yetu at Radio Vuna 102.0 FM nabo tonyora boigo at Zakari Mayeka the journalist nabo kunyara kuba ko tonyora at Vuna TV YouTube ase kunyara kuba go korigereria eyemo ase eyemo emarago biga yaboro ni maite na waziri nere nabo kunyara kuba ko monyora live ase fan page yae
that is live but one thing I can say I like page yame tonyara kwa watu engage yororo Facebook yuko ku Dr. Mbati Mokua you can get me there.
Okay.
Twitter you can get me Mbati Mokua you can get me on Twitter.
Okay.
Ibinde bado tinda ikiranga kingozo lakini ni nyako hapo
nyako endore narangora
na WhatsApp of course.
Okay. Alright, asante sana, karibu sana ntu akwa na chintu abwate chinkwana tokugendera twakwa nira mariogo bwibwa mariogo twanyara ko batoko yamurekera lakini engane nere gaiga n'abanyagitari ngwate banga doctors bare Nyamira bari specialized ya bare
they are now 15
boniga lakini dende asaba nyagitari umucyando go cyoba no gotoka kwa abanyagitari kwa nyoranga abanyagitari bari kirene county government bare batakeri ko base nyagitari maybe ya Nyamira lakini kwa nyoranga nande baachire bakore private gete no bakare you know otakeri ko genda korora umunyagitari Nyamira lakini kwa bari referring umunyagitari yo rarada ya achiyo monyore nyagitari gete kare private na bintu biri bwente konyora Nyamira maybe privileges ubone to chinyorora singincho nyagitari ya serikali to go chigo chinyora aria ase kwamo gwagenda ase private ne conversation ya roro ne conversation igende to kwanero no up to national level timaiti under your leadership kuno mwaziri bo bachenwa ase county Nyamira ngakyugo chiko shugulikere nganeye
say songe gorkunga very thorny issue nganchire ngire na magasi nini yago cha point ye
okay
iyentumkire kia kore kiri Nyamira and I think as a county 47 into county I think number 15 ya kore take which is very important around the women governor asing nchubu anchani waye uchia health sector.
Okay.
One time uganda wetinga daktari, you see health sector is like blood. It means indosi yama nigo mwaye ukuri. So it means health sector itakore tigasi igo government ya korek ya break. Lakini awote wilinga akeroko nyoranga mariogo tayo muntu tara gwen muntu nachikore takore. Igo we have killed mangana yo wukina kwa Nyamira. Akaru a directive. I want to thank him on radio. Akaru a directive agateba goika chinyagitari chetenenere. That is a very serious development. Wetu minera noko. Konyi Nyamira mwako nyagitari ya Nyamira. Konyi mwako collect 10 million. Use 10 million. tinchitageti
Mhm.
tinchitageti elsewhere
Okay.
nyagitari eyo korakie chitumie but of course there is a legislation ekogenda namanganayo ngakoko chitumie this is how you should use it. This is a legislation yaetetibwe ne assembly area ringor and we implemented. Of course there are other things chigenda to call implementation is a process. Taringa konyaranga ya very 100% implementation. It's a process. It was an achievement that we did in the last government. Naende ya tokonyire sana. Nakigoera lero igano Nyamira yetu nyagitari. Actually, I was impressed with Nyangena. Of course, not everyone talking online about Nyangena.
Okay.
And I was impressed. It is one of those facilities in our county government of Nyamira, Amariogaro. And Waguru Nyangena, Kenya Nanga in the one day. Amariogari Nyangena. Where are they getting the drugs from? They are buying.
Okay.
It is a very serious development. Let us say a county. So such kind of legislation which is a landmark, that community health volunteers can now become community health workers. So that Baba corridor training. There are a lot of donors so that they do enough training. So in that training, now they can be paid even if it of course as in our as time goes on, increased. What will it help? That public health related issues. Flu flu public health related issues chicho chikunywe vandu wetu watu wali chicho abantu weri bali mechando chinyomba barusuko bali tunyagitari. Such kind of issues were sorted. So these are a great achievement. Finally, ntaragende point one day. Ekeroto ikaranzete na extra this team which is in Kisi now again that create mangana systems. Whatever as we move forward, they will do a program with a tailored. Do sit down, do a program with a tailored, for instance, Nyamira. What does it mean? Now, at a click of a button, Monyagitaria say karanzete. Never ni mande, ngote computer yane, naligeriga. I can be able to see Muruiro yonabi get bed number 14, Nyamira. That could improve. Because already Umunasiore ward has updated. If the patient is not improving, abangurian eriogeri ndiko mokoni. Eriogata kiri neri. Ngaindari nyore.
Okay.
Nabakurigeri in the system umanyanga erioge ndire kerenyo. Then he orders it from Ekerenyo. That drug yabekwe ambulance. So that is where systems are ongoing. There is an organization called Zipline. Zipline has already done what we call drone system. So that in this drone system, umurweire amanyinga nata keire Ekerenyo. Amanyinga yasa kutoka Nyamira. So what do? You go to ambulance. You just by a click of a button, amanyinga riga kobe in the drone, are lifted by the drone from Nyamira to Ekerenyo. Are received and the drone comes back. So those are the systems that our governor, and actually we are signing an MOU with Zipline very soon, so that we can have a way of transfer easily. So let's come back to this issue. One doctor, according to WHO, is supposed to manage a population of 1,000. One specialist is supposed to manage a population of 10,000. Population, general population. But as of today, one doctor, look at Nyamira, for instance, the total population, population count in a county government, Nyamira now, we stand at around 700,000, 800,000 people. How many specialists did I tell you we have?
15.
15. Abaruira abakogenda in private hospitals, nabagocha in public hospitals. Once nabarui we county the government ya Kenya. Went to Kororwa, Banyora Mariogo. However, this thing I think in government it might bring us challenges. It has domiciled it. Yani ya kebekire in a legislation ekorokunga private public partnership. So what does that mean? Onye tubuate a CT scan, for instance in Nyamira, we now have 2 CT scans which are working. Tubuate 16 slide CT scan, we have a 64 slide CT scan. Both of them are working. But if Nyamira didn't have a CT scan, and that CT scan yes ego toka, ne private facility gete ego toka within Nyamira. No munyagitari yo gukora in both areas. Giana what training. Iga gotoka Nyamira.
Yes.
County Referral Hospital. So Zach, what will you do? Because this resource narrow, lakini yendo geta hiyo ni tools cho kore miremo. In that dispensation ya private public participation, you know, this person nabako genda kororo. You see? So that abarwira baba konyeka from whichever end. As long as on this other side nabago talk. Number 2, you not expect for instance when you get umurwire nale ochire nyagitari yeto ya Nyamira. Otware ruptured spleen. We have a surgeon in that hospital. This surgeon sometimes kora part-time you know magana ya yogo kora partner practice in to say one of the private hospitals. We don't allow Muruira Ruzu Nyamira at the private hospital. One thing we have sat down with all our specialists, the time you are needed to be in the hospital, Kaboro. When you're supposed to see these patients, be there. The only challenge I'm telling you, Zach Tobugate, Keringa, we have only one surgeon. Okay? Yes. We have one surgeon. We are now, I'm very happy now to reporting 1 week ago, one of the surgeons to automated school, we ran it. Now they are going to be 2.
Okay.
But for a long time, surgeon to remember Nero Kuramobasu, Nero Kurangiri Gotuku, he has other issues that he needs to sort. Over a machine, it becomes quite a challenge. And he has his private life that he also needs to do. So Kwanyoranga, it's not about private. It's because Kwanyoranga Nere we call it doing a lot of work. However, Kwanyoranga sometimes there's a sub-specialized service to target. We have an orthopedic surgeon. Let me proudly say, we have reduced the number of referrals which can work. Okay. What did I do when I got in Vuna medical superintendent in Gitari? I sat down in Kaburi. What do we want to do so that we can be able to attract? What do? We need specialists. One Cuban doctor and 2 other orthopedic doctors. And from January when we started to date, we've been able to do around 250 orthopedic cases. Successful. So China Bachiabanto and work. Reduce it. However, some people don't know. So that's why I think on radio I can be able to say this. And we are moving into specialized setup where Unabono Keroka, we put it as an orthopedic hospital. We are starting a psychiatric hospital. Toche somewhere we put an emergency hospital. Unabono naeta senya gitari yete kurkugetare. This evening as I was coming here. Getari ito is along the way. Assuming accident ya gari, if we can turn Getare into an accident and emergency center, specialized facilities, so that we have training of people who so what I can say in private public partnerships, we can be able to share the resource that we have. However, the main thing Nukura Jaka asenya gitari area ekumwaka no mushahara at the end of the month. And that as a facility, that Vuna County, we have put a lot of emphasis on it. Our governor is very specific on that, and we are making strides. Connection they come to work. And I will tell you, if you come to Monday in Nyamira, we have a specialized clinic. Here obstetrics gynecology. They are getting services. You come on Tuesday, we have a specialized internal medicine, physician. they come there. We have 2 physicians in Nyamira. On Wednesday, we have orthopedic surgical clinics. Abantu bali bonse babunigeta amoga bali babalirwe bali bubwate emechando yoko baru and everything they are seen. Abantu beto magenda tukanyora services. Kogocha on Thursday tubwate pediatrics. By the way, tigaga aki, let me brag on radio. Nyamira Hospital has the best pediatric doctors. We are the first facility in this region. Ibwate umunyagitari okurigiriria imikio bongo, a neurologist. Nyamira, a pediatric neurologist imikio bongo yabana. If you come on Friday, they are seen on that day. Those clinics are ongoing. So the doctor will come, see the patients, akore, ward round the major, ward round, akore, again. So if this doctor is found at Getembe Hospital, on your Kero Road, Getembe Hospital, or Vuna Hospital, which is a private hospital, Sambi Satatu Yabotuko, Nantararangi Nyamira Kane, should we crucify him? We shouldn't. This is his private time. Lakini at that time na ndese kurangiri akane kera because mnyagitari na those the call, doctor on call. If you call that doctor akane gocha and he's supposed to be there, then you will crucify him. He has abdicated his duties as a public, which is as a private. Yes.
So waziri samangana ega wakwanira igoro ya Nyamira na boigo ya letire bichanga Nyamira ne bwate systems nande nabekoro kanange bintu mbirobuya. Does it mean n'abantu banyamira batari kunyara kwegene nyagitari ya Nyamira asenge nchugo kwanira igoro ya referrals ekibwa kwanire twarorere abantu abange they claim na services kiroro kerokende kire substandard yagera bata makuru ororo gose barwororo bagenda kinyagitari kinde njuzi gatwaro cyo mu governor we county ya Kisije Simba Arati oko konya omo subati ondoru ya Nyamira agacha nyagitari ya Kisije teaching and referral agacha ko actually abere torore emetinyi umutinyi atarakana none kibesa. So does it mean abantu bari kunyara kwegena nyagitari ya Nyamira gose nkiye bintu kwegi round bire bicenge
tintagete gotebo kwegena no gotamanya. And in my period ya nairu emyaka 5 gukora abantu betu banyamire gasi I'll make sure abantu betu bamanyira no gotamanya. Did you know nga bantu betu this evening Zach, I'll shock you that this evening I was with one of my orthopedic surgeons. We were discussing other issues.
Yes.
There are areas to improve orthopedics. Then one of our senior officer in Nyamira otomira to karas to kwana. You mean in Nyamira we have orthopedic services? No, what is such kind of statement? It means nga and many other services that we are rendering. I feel deep in my heart. Nkoro ya name. You feeling and to wait tombara color sensitization is saying wamanye. Number 2. Let me tell you, my brother. Nogenda Nonya, one of the best hospitals we have in the world. Challenges in China Kobra. Never move. Ngui kuri nyomba ko kuruga igago ikanyomba realizing ngobe kibiti kia te koronda manyeti. Such things happen. Lakini I'm requesting abantu baitu Nyamira, let us not measure asoko kuana nga nagenda nyagitari rero ikibiti kiabura uzinazo nyomba mwana nyorore mukunguga gwake yoginga ngono mwana agukwa kwegeteri kona gwaka mwana kibiti nkayo mwana you know. You keep quiet and find a way of sorting those issues. So I'm calling upon and appealing abantu baitu Nyamira that we adopt and accept the state we are in, and I'm telling you we are doing well. The only thing that tokolenga those improvements nga kitoraga nito chikole by people coming to identify nga a challenge neregaiga, we will improve it for tomorrow. We are one of those facilities who charge chiba sa chirense sana. Imagine nga ekeruwate na child in Nyamira you don't pay anything. As ekero kuro orthopedic cases yendo yoko okora maybe no kubura chichuma. Ekero kwa shire theater ya Nyamira we charge the least. Minor cases very little amount of money. our finance bill. I was looking and saying, oh my God, you mean we have a finance bill that went to be implemented, but we have not yet started to implement it fully. And those are areas that we are going to look at. But the costs that we are charging in our hospital are those costs chira wa attract to the services chiao, but high level services with very little amount of money that you're paying. So I'm calling upon Nyamira. Let's appreciate that this is the facility we have. Don't I take keen Zach? Yasange Omoyo for the next 5 years. Omoyo for the next 5 years. I want you to call me back to the studio. To really ready the journey to Atari in improving healthcare to Nyamira. Tari Nyamira Hospital Yoka, but all the hospitals chaito Nyamira. The goodwill here from government, donors who are ready to come in and support us, I believe we are moving to the right direction.
Okay. All right. Asante sana. Na kunya koligerio gindire wega na tageteri Nyamira ndo chimwe mashini ya ne kidogo. Iko okay, erio karanga tindi kori nyora ncherere ngia. Okay. Nabo tokori nyoranga kinde nyara ko bagingo ko boriri. Lakini rende asengenje tutari nyora ntete ko kunyuri mu nchomo otegereri nga nabo kunyara ko bakori ko bori kwao wetera sogo tome message wetera se number 0706 102 102 nye ko bwato ko boria ose onye ko bwate ngane ndo kunyara ko kugukwana kunye kugoswase conversation yige merago bige yabono arika ujumbe wetera se number 0706 102 102 baigo tunyora sensemo ya Facebook na bogo tunyora at Radio Vuna 102.0 FM nyora at Zakar Mayeka the journalist ya Facebook tunyora at Vuna TV sensemo ya YouTube nyara kuba kogo turikiranye ko bwateri iborio ari kororo ye maseyemo ekrabana togendrete gusanga emargo bega ya bon twenda sumuti musini ndako ira segiduka niko ira naga igatunyara kuba tokogendera asensemo ekenyese kyomorio ke engamba yite margo ya bon. And waziri.
The last item.
Amirongiane na isana na ibere ne chidaika chia butukire igoro ichinse isato togoso aseke ngese kyomwero kigima somoro biro yiga ekera togenderete gosanga no mwaziri Dr. Timothy Ombati mu waziri w'obachenu ase county Nyamira nyeko bwato koboria ene kinga nkori ikora sense mo SMS 0706 102 102 indikira SMS era bono tunyare koba togo sanga amo emarogobe iga ya abono waziri riborira togochi konyera koba tegera togochi gokorera kimaiti gosino manyete okay kinegento na rorete from personal experience kimaiti gose kwanya no manyete ngaba supporting staff bantu bari bagokonya ase kinyagitari batari abanyagitari gose batari aba nase ngokora baremeremo banyagitari batayo ekora nakira sinyagitari yemo narorire omokori emeremo nyagitari oko ibori omusubati nyagitari yemo me county Nyamira oko ibori omusubati in the absence y'omunyagitari se y'omunasi
Wacha kabisa sana. Supportive staff.
yeah.
Supportive staff narrate does supportive services. Supportive services means I make sure nga asari na clean. Na ro make sure nga ntobuate enough supplies yebintu bete bigane area. Supportive staff mbali who are supporting, especially as say some critical areas. To what supportive staff obeyed maternity for 20 years. I'm giving an example.
Okay.
Some of these things, let me tell you, medicine, unlike some other disciplines, medicine,
Yes.
people learn with experience. So when your Montoyo has been there for 20 years, in Tatabuati, one certificate, Tabuati, the knowledge area of Tabanga, Eatari waiter and Atari. Lakini already NCA go support umutwe wo mwana as the baby is coming out for ages. Sometimes NCA amotebiringa asingincho umungino yosinyiru go push. Sometime back miaka ya itire they used to give you the fundal support. Fundal support neringa sukumere na inche support yo mwana achiche. That is supportive staff.
Okay.
For a long time nana kwa naga health ya twalire issues na human resource. Yani abantu bali bakolega shoro. So miaka ya itire uchimaga gaiga umuntu byo beire in the system for long. Abakomutinga supportirie egasi yuegenderere yani mkonye egasi yuegenderere. However, they do it under supervision. Some of these people now over achieve to a point kolire ekosi at 6 months, 3 months, 6 months ekorokunga nothing aid. Okay? When you're monto, of course you're very inexperienced for long, ogenda komenta masomo makego obe nursing. Ocha gokonya ono kawata that certificate and experience. So because each number go kare, I don't believe with it's happening right now. Because each number go kare, chinke, when you're in a yam, in your guitar nene. So I think in Chukwabera for long, Liba go to go mwano yo kerense, Quarumonginoga Kuibora, you could take this mama, yetanda, almost support Aibore Boronge, as you call for the nurse, or you what the experience to come according to the other necessary procedures to enter correct. That is why a Ministry of Health, the county government, just threaten to spree employment. Can they realize the I will tell you today, I was in one of the smallest facilities ikutuka burabu I didn't know gari burabu until I got to know it was burabu Kirumbe a very small facility it's a dispensary what china sire isn't china sisa to in a dispensary that go kora day and night there is a good number of people to support I'm trying to tell you nga even that smallest facility to Buate right now has quite a number of staff some of these things when you want I don't want to negate think that wokana ngankiaringe kubagero korekana it used to happen but inko happen kere when somebody has been in a system for long it used to happen ekero montabere system for long amanyire ngakiyo korekana haya batabuati the perfect knowledge ngakiyo wento kokoro or support that's why to work support staff or support as the qualified person comes kora the remaining part but that one no longer happens we have employed a number and I can tell you more employments are coming to know enough people who run services.
Alright, asante sana. Tigangi tera sechi SMS wangu igatu matotara kora. Arega iko kuboringa what about casual staff payment and the regularity of paying them because they work in health centers?
Namanyanga wachakuwa na gari swali ngaricha asengencho ended because of the low numbers ya colleagues I've already explained it.
Yes,
we got into employing casual staff and I have to say asengencho for a long time to the challenge kero to have devolved. We didn't have a legislation about the chiva sachiricha very collected chigocha. So we could collect chiva the chance P and then to a central pool. That is how low. Neri chico. Utaringa nyarebe gokorego. Chico na waligo tebego. Ngachiva chance P county, chiava collected, that is owns the revenue, just account. And because of that, chiva the chico account. Na hendo we katokanye. Tuwabira ringa rende chiri tuwabigete account tuwabira kuturusiri ono waikara sabaranga Nyamira ngezi bachara tata million 3 okay can give them 1 million so somebody who sits somewhere tamanyeti how healthcare runs or deciding a chibesagete chigende chinganaiga so that is why the Ministry of Health ekaru guidelines ekaba doubled up na COG, Council of Governors.
Yes.
Egateva, you have a period of time that we should have a facility improvement fund. Chiba fenced. And that is what I'm telling you today. I am happy. When I came in as the medical superintendent last year, Nyamira Hospital, casuals van Konyombarakan for 12 months. Imagine. It's because she was in piecemeal. So dividing that amount of money for Akana becomes a challenge. Yes, 12 months. Yani hope. Hope. And I appreciate them. I love them so much. That much I could strain. It means a lot. So Kerana we continued. Governor appreciated. Agateva now have a 5. Kurumuti Yosaba, we are now paying them as a facility. I have paid them up to date. However, there was a lapse, which was taken up as a pending bill. The supplementary budget to which we discussed, it is already in the bill, in the supplementary budget, and I promise that once the supplementary budget has been uploaded into IFMIS, they will be paid the arrears of 3 months, for instance in the main hospital. Lakini kurumu tinyo saba osita gotira osaba gotira they are up to date paid. Now mbare barichi lower facilities bagwate arrears chinene. It's because of the partners baitombare konyoto prayers na barwoda nida. Already we've also factored them in the supplementary budget and they will be paid. Yes.
Now you are covering health sector is understaffed. What are you going to do in person about this?
I agree. When I was discussing the number of staff we have vis-a-vis WHO, the number is limited. And because of that, and you see now, a challenge in there, we have people who are cheering for green pastures, who are cheering Mumbi, who are cheering Canada, America, and they are retired. And that is one area we have looked into, and that's why we are bringing in partners to support us, and also we are also doing employment as government. Very soon we shall advertise, and employment will be done, especially as well as government. I mean, from the mainstream government, where Chirisco, we will advertise and employ, so that we add on. It is work in progress. That again to go kurudi motokore. To go employ bantu rori moiga mokore. It is work in progress. We will employ, like I said, into what 3 consultants. To employ bagaika 10. To employ bagaika 15. We will continue employing. Rome was not built in one day. We will continue growing in that line.
Some facilities, they don't even have a fence or a gate.
Yes, it's true. But it's very true. There are some facilities you would rather move a gate. That is a sorry state of some facilities.
Yes.
And it's something we've started working on. With the coming of FIF, the Facility Improvement Fund, now facilities can be able they can budget and fence and do great things, even as we do support the appropriation money equitable share so that we can be supporting them. Some other support is coming from partners. But I'm telling you, it is the first county, I mean it is the county among the 15 counties to ring fence in health. So that this money in health motivations, some small things, fencing. Fencing is a small thing which can be done.
Yes.
It can do some of these things as we also wait for the support from the Equitable Fund and other partners.
Kama walimuweka, kuna wakati walimuweka ni kama waliona ataweza hii kazi katika kaunti ya Nyamira. Ni Emanu yeke moni, okay. Rawakebanga walikuweka, waliona utaweza. Asking if Waziri is aware of the UHC staffs under their contract ending May next year.
Yes. What
plan does the county have in store for them since the county is understaffed?
We have 1,180 staff for health. That is doctors, nurses, clinical officers, all these kada. We have lab, we also have 256 staff who have been employed by the Universal Health Coverage. His Excellency, former President, did he COVID year Soete, and in the wake of there are those who were COVID, but in the wake of UHC, 256. Their contract is ending next year in Uganda. Oyokolik, I believe, is one of them, and I'm requesting them. Be patient. These engagements have started. We will engage at the Council of Governors level. We will engage as the caucus of CECs. We will engage with the ministry, because I know once you are employed, you are a government employee. You will not lose it. There are those who are employed for 6 months. The contract their contract was again extended for 3 years. It means government has plans for this. Remember, government in area to check the UHC, national government in area to check the UHC. They don't want it to fail, because their facilities in Nyamira, by the way, as I'm talking to you, Chikowa manage the UHC staff. So let them be patient. It is work in progress. I've already engaged them. Now, but one area, I've spoken to a number of them. I've engaged. Now, but we have a patient. We are going to find a solution. We have around 7 months to go. And in that period of 7 months, I believe we'll find a solution.
Right. Yes. Yandako tumari ibori ya wetera 0706 102 102 0706 102 102. Adegeko Kubori, good evening. Good evening to you. I am happy to hear that our county referral hospital is now offering orthopedic services.
Yes.
I too being a medic, but never knew this. Maybe to inquire, most hospitals lack family planning commodities, to be specific, long-term methods like implants. I confirm that I confirm that the Daktari is doing good work.
Thank you so much. I've seen it. I have to appreciate not every and the anti-venga can and killing to wait on Barama. But we do orthopedic cases. And we do it in 2 days. Actually, we don't wait. We go Charero. Wednesday. On your Wednesday, Friday, unless it's an emergency, it went to call immediately. But these orthopedic cases, we do them twice in a week. And we want to sensitize them to wait to Mamanyanga. We are doing these cases and they come to hospital. Number 2, family planning. If there's an area that the government here invested mono is on mother and child health. Mother-child health, the government has invested fully. Actually, it is almost everywhere. You will find the mother-child health care and return. So I don't know why, unless it becomes specific, but one thing I know, the directorate, reproductive health in our county is doing a lot on mother and child, and we have a lot of support. A lot of support from donors, a lot of support from partners, a lot of support from the national government, and a lot of support from within. It's one department, one directorate, a serious problem with. So maybe I have a specific which areas, so that from here I can be able to go and look and know where you're at. But mothers are getting family planning, and advices are ongoing. We are doing both short, long term, including complete. Vasectomy to whatever you have vasectomy. They have not come. Yeah, but we've been doing these other methods.
Waziri, I'm inviting you to visit Geta Dispensary in Gesima Ward, Kebuko sub-location.
Yes.
By the way, Geta Yenye Maete. Geta ye actually go talk yoga ro chari go check yakaro kiruri but. By the way, this is the hospital was a dispensary okonyora. Kerene toro ngombe sibire asenya gitari. You are saying in operational.
You're not the first person telling me that. No, you indicated you're not telling one time ago. There are quite a number of people want to. Now let me say this. The last government was coming to an end. There are quite a number of facilities and I know it will be a thorny issue to look at. Let me say it. Quite a number of facilities chikagachwa, lakini resources chigo chakachi facilities chikabe challenge. And because of that, okajaranga enyagitari ya gachiru yarire tarigeta yoka iyenenere kare guchigora ria zakoro kunyaronge iyenenere kare within Gesima there are quite a number of them. Burabu there is a facility ya gachi tuororo etarachaka. There's another facility at the township Nyamira township ward. Quite a number of these facilities were started. Some of them are either finished, chikarar, wose chinde, chiwata some bit of stalling, chitaraira.
Yes.
What we have agreed, and this is what the discussion we are going to set in the department now. We are going to agree on facilities. How are we going to operationalize them? If we cannot be able to operationalize them today, how can we organize the ones which are near them to be well operationalized as we continue operationalizing each chimney?
Okay.
Ikiagara tinta itin promise yo montonga ngo chakande e facility ngo chane nyore nyechakie when I know I don't have a commodity, I don't have a resource, human resource, when I don't have the minimum requirements. But those are some of the areas. A department. So those are the areas I want to sit and look at. Number 3, we also need to be very genuine and fair to ourselves. Township, Nyamira, Kiano Menyata.
Okay.
Kwanyora was saying Nyamira Hospital, which is the main facility. Kukusuka, angine stage, of course, but I'm giving an example of what is happening. 200 meters to the east, Kwanyoranga, Nero. 200 meters to the west, or 300 or 1 kilometer to the west, Nero. Okay, and another few meters, Nero. I mean, are we being fair? Instead of having one facility, we equip it properly within that radius, and for the best of service. But I'm giving it as an example. But I'm trying to say, if that happens across that one radius of all, almost at 1 kilometer. Are we being fair? Okay. If you are all these 3 hospitals, we need a doctor or a nurse. We need medications.
By the way, abantu bagenda tukuboria amabori abange gaiga genuine concerns. Tunyara kuba toko ya iraneri aso bwango bwanga singencho nga oise koruga igo tara ya iraneri. There are those who applied to specialize in various fields in universities and KMTC, but yet to receive release letters. What is the county CECM doing about it?
That's a very good question. The 15 consultants who've come back. Reno unit. We have a Reno unit in Nyamira. All the 6, around 7 nurses who are working that Reno unit in Nyamira are nurses who are working in Nyamira to release Vakaine school. The doctors I'm telling you about, we released them, they have come back. Clinical officers, some of them specialized. In various fields. Totebe, anesthesia, totebe, family medicine and all that, are people who are trained Nyamira. So we don't stop people from going for training. However, there is a catch. Catch ne to what the clinical officer even Bosose. I'm giving an example. These 2 clinical officers in Bosose will apply the ones and go course. What will you do? You look at the need yenya gitari, you release one, otigo yo mara koraki, aragenda rago kuregas. Or you and once employments have been made, or you never released, montato ko cover that facility. So we have not stopped anybody kogenda for training. And I'm going to look into this very closely. So that those who have genuinely applied, they have taken time, they have not gone to school, and their replacements, we will release them again. And as the employments are going to be made, they get into the shoes. So we will release them, but we will look at around us, the number of people we have around and where they are working, so that we release them in that way.
Hey, I'm Job, healthcare workers who have gone to school and specialized in and now offering special services have not been promoted to the special job groups. They are now demoralized. What plans is the minister having for these people?
It's true. There are quite a number of them are cheated. They were promoted to their rightful job groups. Promotions, which will happen, it's a process. It's a process. And this process is which a department. So the moment you've come back from school, Kawera accepted, was promotion process ya chaka. So that Wabuguria documents chair discussed in the department HR committee, chair watching and the county HR committee, from the county HR committee chair as a public service board. Public service board yachiko implement. Even as the public service board is implementing, there's an area to budget. ikiara promotion comes with money. So that tokoi promotion and there's a budgetary allocation. So that's why this time around I was looking through the supplementary budget when I correct way. They have factored some of the promotions that have been done and people have come back. We have quite a number of promotions that are lying. We are waiting for them. There was this process here through the Konyochari around the campaign period. Chikarava held because of the turmoil that was there, but slowly they've started releasing them. So that you want to wait one promotion, but attached with a pay hike, they go channel promotion chiria. So then it's work in process. I'm requesting my healthcare workers, my patient. I have been in Nyamira. I know what we have been going through in Nyamira. Taking me time. I'll go through it, and together we will walk through the journey. We want motivated workforce.
In Kisii County, our staffs take lunch in their hospitals. But in Nyamira health centers and other facilities where my colleagues work, there is no meals, as some told. They survive by their own means. Are you aware?
Very much aware. I don't want to talk about Kisii County because I don't come from there. I don't understand what is going on in Kisii County. Never any opinion here.
Yes.
But now what I started a tendency ya colleagues nebe sani kuragera in the hospital lunch hour. Na hindi na wapa ke chai banyu at 10. Na wa lunch waria. I started it. It's an initiative you're more the in charge your facility. Now with the coming of ECO and the FIF, it means that we have money around us that can motivate staff. Motivation is not about money only. Motivation is about good environment. So it is an initiative I will pick up. We see the sustainability. So I don't want to borrow a leaf from Kisii because I don't know what is happening in Kisii, but such benchmarkings are very important. What is the sustainability? But I'm giving you an example of what is happening. It's a practical example. Esani, it is happening. If it is happening in Esani, then it means the leadership can be emulated across, so that how is it done, so that we can be able to also implement it. But what we are offering in Nyamira, we normally offer tea break, so that medication and some facility offer tea breaks, and this is not across, of course. It's in a few other facilities. I think it's because budgetary constraints. There's some budget constraint narrow, and constraints in Chio and such like. So it's about leadership and management within facilities.
Do we have oncology unit in Nyamira?
We do, but mostly we do palliative care. Because we don't have a specialized oncologist. We only have oncology nurses who have gone to training, and actually those oncology nurses need to do our training. They are our nurses whom we released wakasoma wakairana, and these are the ones who are doing mostly palliation, but in collaboration with some other organizations. Yesterday there are guests who come from, there are some partners who came from US, and we discussed, we agreed on the roadmap. They will tour a functional oncology unit, and it's also work in progress. Yes.
Is Waziri aware that some facilities close at 2 p.m. and you find that healthcare workers stay in the facility compound and they can't give a service, especially Motontera dispensary in Nyamira South?
This is where now we are calling upon our public.
Yes.
Zach, you are aware, you're on social media, you've been seeing me moving around. I move around paka saa 8 ya butuku. Do you know why I'm doing that? a community ngo teberinga ikita really kuruku motontera. I'm happy I've learned about it. I'll put it in my itinerary as part of the facilities I need to visit. So nye montondo kwenye kuru motontera batebie kwenye bago sieka saa 8 batebi ga kimba sieka saa 8 kiara I'll come. And of course there are some disciplinary measures that needs to be taken. But really mono minto kwa rikirwe asiriru beriri ya uri okurikwa gerikire biyega. Now you're supposed to work for 8 hours. From 8 to 5. However, mtopuate some other added advantages for the people working as nurses and healthcare workers and doctors and all those. So you can be called whenever there's an emergency. There is also the other aspect, some extraneous support, so that you can work some extra hours, okay, just in case there is anything. But dispensaries, they are open from 8 to 5. So there are those other facilities you go. So you don't have any go no go tar impromptu visits. Natara gotuko, narosa bantu go kore baregas, usebakora. Nakora natara iskari na kwa na bantu wetu bantenga kiwaga ndrete. So yes, I'm not aware about Motontera, but I'm aware there are facilities that open late and close early. They are treated as rumor until I have proved it. And so what I've done, most of my work on your the cabinet, on your timbuati meeting in the office, you collect a report on what is happening. You want to have a feel. One of the things I've told myself, I saw you on the ones you're correct as an angel. I mean, if they think I'm lying, they can call and tell the studio that I'm lying. The ones you're correct as an angel, I am a workaholic. I'll be in the hospital early, it's okay, late. I'll be called in and I'll walk in. Sometimes I'll even walk because where I stay is close to the hospital. I'll walk. That means I'm endangering my life. Lakini nate banga, however much I'm endangering my life, and that is what I would like our people to do. Kwarikirwe gasi, kwanto bari iska batagete gasi ye, gasi kwarikirwe ye korenga mamumi no kwarenge gokorera. Ye korenga tatu mino, ye korenga no mwana mino, nkikwa ngoche gokora. That patient needs your support.
Abel Kebati koromongoni iko koromongoni utebanga ikobo wa watare ile mongoni dispensary
bado
tebu ati mariogo mopango kyobu atebocha mongoni
ndege kia mariogo nage kwa na mapema. I want to repeat it. We have a challenge here ya mariogo. We have had a challenge ya mariogo, but we will sort it. It will be a thing of the past. We need a bit of time so that once the legislation is we will have sorted it. However, for the meantime, governor made a very serious step. We can buy drugs. We are buying from meds. We have committed around 30 million shillings for drugs, which has already been for such facilities. Vuna meds, igeko bakuganyo bakane mapema wamanyogo kwa mario. Of course, that needs some procurement process, which has already been completed, and there will be drugs in our facilities. Lakini we have again started another consignment from KEMSA. Requisition for KEMSA, so that onyora mariogo. So until the time we are done konokorosi legislation, we have also put in place measures to circulate, but also another way, main facilities, level 3, level 4 facilities, and level 5 facilities were given where they can buffer as we wait for the other consignment to come. Yes, there might, it's true that Mario Taisaini, Mario Taisaini, they are Taisaini, Mongoni. But then we ask our people to be patient on us. It's a promise in Akora. Now we have to follow up on this issue, Mario, and we'll follow up to the letter.
Okay. Anala ukienda Kisii kuna madawa, Nyamira hata pana dola kuna. Okay. think
issue ya Mario nere na kwa nirenga
Tuwaye
ama ene na ringa ki bantu baito na baru they should be fair to us. Taringa Mario gota yopi Mario gonkonya oraro na rororo, but kwa nyoranga the larger percentage ya irani lensa singa jo supply chain.
Okay. Kero kinde katogo korera bono moroberio omugima nororioyo strategy ya onere rieye bwate towards gokonya Nyamira County health sector.
In my way in the Nyamira health sector, and what I'm planning to put in place, I can make sure number one, we have put down systems. Chico monitor all aspects of healthcare. Chico monitor human resource. Chico monitor commodities. Chico monitor services. So that is one area I'm going to look at. Secondly, I'm working so hard to make sure na commodities tari mariogo, commodities na mariogo, amanyinga, in the way to make a lab, TX-ray, ultrasounds, and all these other things, chikogera services, chirani buya. I mean, some others are equipment, they are well supplied, other commodities are well supplied. There are facilities, chigande to kwa gacho. I will make sure na chiagachiro to the letter end, so that tonyore abantu baito banyore services chirange nasi bari. Another thing kuchikoligereria na mangana healthcare workers. We are going to sit down, look for budget, look for sponsors and support from donor, facilities, so that tonyore human resource for health and enhanced. I don't want to break the juice, but we have great plans ahead of us. We want to bring the partners to Nyamira to reduce. We need to find a way of attracting more partners to support us. Let me tell you, health is big. Government, we must get support from the partners. Enhancing the collection of finances in the hospitals, channeled in the right direction, chikonya bantu baito on the ground.
Yes.
Automation nanya kwane. Making sure that the doctors, the nurses, the lab techs, the radiologists, they are available. Community health workers, making sure that the legislation yatigwe wantu baito wakanirwe irinda batokonya soko koremereme. Making sure na casuals baito wakora nyagitari akanirwe. Abanyagitari bari baito batatokona chisukuru aba released bagenda basome. Irinde bayirane bamente amasomo ari banyorire atokonye. Making sure na abantu baito, and this is the call I'm making to the public. Abantu baito tika to ire insurance. NHIF, it's 500 shillings, but it can save your life. So let us take insurance. Erinde we reduce chibasa chichikuru muguko chigosoka uchisikari chibasa chiwe ichikuru ase insurance chiche chitokonye. I want to remind our people, early seeking kurikia obugwenya bwa mapema is very important. If you don't do that, what you wish to kera really work I'm calling upon partners to work with us so that we can enhance the services that we are offering. I'm going to expand the services, setting up specialized centers. I told you some key areas we need to look at them. We have partners who are ready to support us so that we can set aside those centers chiko tokonya asokurubu wenya or specialized which is abantu baito. And above all, tukoregas na abantu baito banyagitari baito tukoregas nabo babe motivated biya ina baragwa tu aromoyo wo koregas ni county yetu ya Nyamira.
Okay.
Yes.
Right, asante sana waziri asingi chogo sangamo na intwe kwenye wala chinga kiechinga kwa chagaiga mete na ko rangire out of your busy schedule. Lakini kwenye kwa gukorosia chinga kinago chaga gerabona tujana ko batugo kwanira umunyamira igoro ya kebo chenu meti nana ndeyo moerio nyikubwate kero kenda abantu mbare ba mogo korana barabuo baganiti unyare ko bagoko ba appreciate yasebyo ukonyara ko bakogo kwani babire batatu.
Nimete my parents mantegerati, but I know they will be told in another kwani kurwa se radio.
Yes.
My wife, nimete nantegerate, Naomi Kerubo.
Yes.
Wherever she is, I appreciate her for the support that she's giving me. I am a sociable person. Timetuse kinegezongekia muntu w'abantu ngukunda tuna abantu abandi. Ninde chikurupu chinyinge sana social media. Chikurupu cha manga, chikurupu cha kyobuto, chikurupu cha Nyamira News and Updates. It is one of the biggest groups do at Nyamira. Ekuligeria mangana mange siasa na kirege. I salute them a lot. I also salute my friends, the crew, who have also supported me a lot. I salute them a lot. I salute all my friends who are supporting me. I salute them.
Yes.
And above all, I salute the work that my governor, His Excellency Samson Yerugu, has done. That I want to remind you that tomorrow we are having an ambassador from Australia who's visiting our facility, so that they are to support in the growth. So I'm welcoming our people. They come and listen to him. Of course, there are some in Tobira which are not on the Mambi. Uyura Chaki the Sasta Yamwas. Baby Vinge and the wait. That to go and get to water and to go to Nyamira. And I want to tell you, together na Chief Minister Church wa Nyamira, I am seeing passion. If we go with that passion and the support to Governor Toet, abantu betu wa Nyamira batoe support. And support our deputy governor Toet. Let us move forward as a team so that we support abantu betu wa Nyamira. Nyamira will be a Makueni very soon. Yes.
Okay. Asante sana waziri, karibu sana nande jitukolinde katugo kurangiri. Twarengene romo waziri Dr. Timothy Ombati, ujoro waziri we county ya Nyamira sense moyobo chenu. Nyariko ko batuko morekera mangetu ye yobo chenu ayo tureneke nenga usitureno kwegena ngana nyariko bakagwikirana. Ye radio Vuna 102.0 FM asomoro biribo yerobo tukobo iga bwarero. Jenko kwa Zakari Meyeka, asante sana sebari mwabiri mwogo tubuati, asemitandao ya itoa ati Radio Vuna 102.0 FM, asenseme ya Facebook, ati Vuna TV, asenseme ya YouTube, bari mwabiri mwoko mbuati ati Zakari Meyeka the journalist, wigo mwagendre tebusanga mwana intwe margo biga ya abono. Chida ya kamera wangebere na kianga, igoro ye chinsa inye chi abono.